And joining us now is In Focus Health Correspondent Linord Moudou.
Hey, Linord.
Hello, Vincent. Hello, Dimiake.
Yes, what do you have for us today?
Well, today we will talk about polio, and there are some good news. Angola celebrated an entire year without a new wild polio virus recently, bringing the world closer to the goal of eradicating the contagious and crippling disease. Ricardo Monteiro is on his way to work in Uije, a town in northeastern Angola. The 26-year-old contracted polio when he was a child, which left his legs paralyzed. Monteiro came to Uije after being rejected by his family due to his paralysis. He now works as a welder and says that he wants others like him to know that they, too, can overcome disability.
I learned how to work with steel to make doors and windows the way my instructor showed me.
Polio is a virus that attacks the nervous system. It can cause irreversible paralysis within hours of infection, usually in the legs. The disease often spreads in areas with poor sanitation. Children under 5 are the most vulnerable. Nearly every country in the world has successfully eradicated polio, but it remains endemic in 3 countries: Pakistan, Afghanistan, and Nigeria. This year, in January, India became the latest country to become polio-free after going a full year without registering a new case. Angola has also been polio-free for 1 year. Analysts warn that unless sanitation improves in parts of the southwestern African nation, efforts to eradicate polio here could be threatened. As a polio survivor, Monteiro wants to pursue a career in nursing, and he is saving money in hopes of being able to soon join a medical school.
I have a future of beauty and a good life. Next year I will study for real because of the little dream I have of becoming a nurse. And of course I will get it because I have this strength.
Medical experts say polio can be halted with comprehensive population-wide vaccination programs, but as long as a single child remains infected, all children remain at risk of contracting the disease. The Angolan government and other development partners are now leading extensive polio immunization campaigns. In Uije, health workers from the charity Pastoral da Criança are educating residents on preventing the viral infection. Enedir Rosa Correa works with mothers from the Kathenga municipality in Luanda.
The big contribution of Pastoral da Criança is that these mothers don't have a problem going to families to talk to parents about the importance for children to get vaccinated, which is for the well-being of children.
As of August 8th, there were 111 cases of the wild polio virus reported worldwide, almost 3 times lower than those recorded during the same period in 2011. Now joining us from the Centers for Disease Control and Prevention studio in Atlanta, Georgia, is Dr. Rebecca Martin, Director of Global Immunization Division with the CDC. Dr. Martin, welcome to the program.
Thank you, Nina. Good afternoon.
Good afternoon. First of all, let me have your reaction on this recent development in Angola and what is the significance of this for the global fight against polio.
Thank you. Now, this news for the Global Polio Eradication Initiative and for the Centers for Disease Control and Prevention, which is a partner, is wonderful news for the world. As you heard from the personal story at the beginning of this segment, it really is changing lives, and this is what polio eradication is about. The 1 year polio-free in Angola really shows that this can be achieved, and the great success that the government of Angola has put in at the national level, at the local level, and also the requirement of the engagement of traditional leaders so that it takes everybody to do this. At the global level, we see this as a great, significant milestone towards the achievement of global polio eradication.
And now it's been 1 year with Angola. At what point will the country be considered, will there be complete eradication in the country, meaning like what are the certification in terms of global eradication certification?
As you know, there are still 3 countries that remain endemic for polio. This is Nigeria, Pakistan, and Afghanistan. What this means for Angola is that they've had a year of non-polio in the country. And we regard this with great news and great enthusiasm, but as well caution, because as we know, as long as polio virus is circulating in the world, it can be anywhere at any time. And this is what we're fighting against. Angola must keep up the efforts now in the second half of this year to strengthen the routine immunization program, to strengthen the delivery of the vaccines, as well as the detection through the surveillance systems in place to be able to detect if a virus is imported into the country. So while this is great news, there is also the risk that this continues. And it does not mean now that Angola is eradicated polio. This is a process that's required that takes much longer, up to 36 months of having no virus being found in the country. But this is a good step forward in this area, in this progress, and we welcome this news.
Now, as you just mentioned, Pakistan, Afghanistan, and Nigeria still remain polio endemic. What are the challenges with these 3 countries?
I think I could sum it up in 2 words, which is missed children. Children are not being vaccinated. And the reasons for this are numerous. I think we can look first at some of the challenges that have come into play with looking at the transportation, looking at the security of some of the areas in these countries, the conflict that has been occurring, as well as the geopolitical and the political commitment. However, we have seen in this past beginning of this year changes in that with high-level political commitment, with each country developing emergency action plans, with each country now committing to reaching polio eradication. But the effort is really to find each child and to vaccinate them.
Now, this past May, over 190 countries at the World Health Assembly declared the completion of polio eradication a programmatic emergency for global public health. What is the significance of this action, especially considering there are lesser cases of polio nowadays?
This is true, and this is a great moment in time. We sit a little bit on pins and needles at this time for this news. There has been great progress, and we must continue the efforts that we're doing. What this means is that all member states of the World Health Assembly have now agreed to activate their emergency action plans to shore up any susceptible populations, any children that have been missed, to vaccinate them. But in addition, it means that the detection, to make sure that the vigilance is there to detect if a virus is imported. All of the countries have now committed political commitment towards this and towards helping one another. I think this is very important, the fact that this is among all of the countries, and this is a global effort we need to do together.
Now, quickly,
as our director,
go ahead, please. Continue.
Thank you. As our director, Dr. Frieden, has mentioned many times, we have never been this close with only 3 countries left, and the importance of really finishing the job now. The peril, if we do not do it now, is that we can have up to 200,000 children paralyzed in a decade, and ongoing indefinite requirements to support these efforts and cost. So we cannot fail, and we must do it now.
And quickly, in 30 seconds, there are 2 types of polio. Who gets the shot and who gets the drop?
This varies by countries, and this is a country policy. You're talking about the oral polio vaccine, which is used in many of the countries where there's still polio. And the purpose of the oral polio vaccine is that once a child is given the drops, it passes through the system and is also put into the environment, allowing other children to come in contact it through water and different sources and also be immunized. And we call that contact immunity. It allows more children to be vaccinated than each child getting a drop. So it allows this opportunity for them to get more coverage and to ensure that there are no susceptibles left in the community. Okay. And this is the purpose for the use of the oral polio vaccine.
Great. Dr. Martin, thank you so much for joining us.
Thank you.
And that was Dr. Rebecca Martin, Director of Global Immunization Division with the U.S. Centers for Disease Control and Prevention. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website at africahealthnetwork.com.